Hello everyone, my name is Taifur Khan and I welcome you to the first episode of Your Doctor Knows the Best, a talk show where I will ask your questions directly to the doctor. Today, I have the Medical Director of Advanced Fertility and Gynecological Center in New Delhi. With numerous awards and more than 30 papers published, she has served the humanity for more than 2 decades, with her work experience ranging from serving in AIMS in New Delhi to ARGC in London. She has been working with her self run IVF unit since 2015. Ladies and gentlemen, this is an honor for us to have Dr. Kaberi Banerjee with us in this show today. So, ma'am, as we can see around us, ever since the vaccines are out, we have had multiple and numerous rumored theories by different people about the vaccine. And as a matter of fact, a lot of them revolve around women's health and her body. When we see the government pushing its people towards vaccination, when we see such a great vaccination drive being carried out in the country, and we see that vaccination is the trending topic and talk of the town, I think the first question that arises between the families who have pregnant women among themselves is how safe is the vaccine for pregnant women and what implications can it put on the upcoming baby?
As you know, there are many vaccines, Covishield, Covaxin, outside Pfizer, Moderna, and most of the trials have been done on non-pregnant women. And the reason they are not being earlier advocated on pregnant women is because the study population for the vaccine did not include so many pregnant women. So is it really safe on them? Not much data is there so far, but these are all dead vaccines. None of them is a live vaccine. So with these vaccine, you will not get COVID infection. You will just get a immunity to fight the virus. And in today's world, with the virus spreading so fast, we have to safeguard the pregnant women because the pregnant women, if they get COVID and if it becomes severe COVID, they have higher risk of respiratory problems, ICU admission, and even problems to the baby. So, pregnant women are very, very precious and they should get vaccinated in today's time, and all the more for those who are older and those who have problems like diabetes, hypertension, etc.
As we just discussed on pregnant women, I think the next stage comes when they start lactating. So this can be a matter of concern among new parents, that how safe can the vaccine be, considering that the mother is lactating, and can it put any implications on the body of the child?
So, see, there are two things. One is when the lady is breastfeeding and she has COVID. So the question sometimes is, should you breastfeed the babies when you have COVID? The WHO guideline is that the mother's milk has antibodies to the virus, and by taking all the precautions, double masking, minimizing contact, just giving the breastfeed, and then keeping at separate, distance, breastfeeding is not contraindicated, even if you have mild to moderate COVID. Number one. Number two is once you must get vaccinated even if you are breastfeeding. So this vaccine will induce the antibodies in your system, and these antibodies will protect you. They will go through the breast milk and protect your newborn. So yes, even breastfeeding mothers should get vaccinated.
So, ma'am, the virus cannot affect the baby when they are being breastfed. Only the parents must minimize their respiratory contact with the baby.
Yes, they have to follow two, three things very strictly. The baby should be near the mother only during breastfeeding. The mother should have wash her hands, sanitize her hands properly, wear double masks, clean the local area properly, just subject the baby to breastfeeding and then isolate.
When girls are in their menstrual cycle, can they take the vaccine if they are on their periods? I mean, the day they are due for getting the vaccine, if they are on their periods on the very same day, what can they do?
Yes. Menstrual cycle has got nothing to do with taking the vaccine or not taking the vaccine. The vaccine, once you take, you will be slightly unwell for the next 3 to 4 days. Yes, there are some women who have extremely painful periods during their menstrual cycle. So they can postpone it by a few days. But just because you're having your period, you should not take the vaccine. This is a complete myth.
So many parents are also very much concerned regarding the implications of the vaccine on their daughter's body. There have been talks about infertility and many things. So, what are the effects of the vaccine on a girl physically, and does it anyway affect their fertility?
See, that is a very important question because many times these women feel that if you get the vaccine, you may become infertile, or it may lead to the infection in you, and your fertility process will get damaged. So, again, the guidelines are that whether you're trying to conceive or whether you're undergoing fertility treatment, there is no need to hold the vaccine. Please go ahead and take the vaccine. The only thing that you have to take care is around the time of the important procedures like the egg pickup in IVF or embryo transfer in IVF or IUI or the most fertile period. Around that time, if you take the vaccine and if you get fever, you may ascribe it to various other factors. There's infection in IVF or something, something. So you leave the most crucial time. You can take it before, and you should be vaccinated. Number one. Number two is if you get pregnant, you should get vaccinated, preferably after the first trimester. After 3 months, you should get vaccinated from fourth month because not much data is there in the early part of pregnancy, which is very crucial for the formation of the baby.
So, from fourth month to the rest of the pregnancy, they can take the vaccine, except for the first trimester. Pregnant women can take the vaccine in any other phase. So, ma'am, a statement was released by Foxy that vaccination should be extended to pregnant and lactating women. But there have been no comment on this from the Ministry of Health. Even Government of India has not yet recommended the vaccine to lactating mothers. How do you see this? What would you like to say to our viewers on this?
See, as you know, we are going through a very tough crisis period, the whole country. So each and every body, be it the government, be it the doctors, be it the people, everybody is trying to give the most optimal care. So now the people like, the Foxy have, requested the government of India to allow pregnant women and lactating women to get the vaccine. And we are of the information that very soon this will also become a mandate by the government. Any patient who is asking us whether we should or we should not, all of us are recommending that we should. Of course, as soon as the direction comes, it will become a very welcome direction from the government, which I'm quite sure is going to come very soon.
Thank you so much, ma'am, for giving us time amid such a tight schedule, and also thank you for joining us.
Thank you, thank you, and you're doing a good job trying to spread this awareness. All the best to you.
Thanks to all of my viewers for joining today. Please keep watching and don't forget to share this video with your friends and family to spread awareness. Remember, we are in this together and we will fight this together. Also, this is my earnest request to donate any little amount that you can afford. Our little contribution can be the reason for someone's happiness. With this, I sign off today until the next time we meet here. Please stay safe and stay indoor. And don't forget to wear your mask when you're going out. Please minimize your external encounters only till it is very necessary to go out.